Greetings to one and all. What happens if a cavity is untreated? First of all, let's talk about a cavity. Dental caries is nothing but an irreversible microbial disease of the calcified structures of the tooth, which results from decalcification of the inorganic substances and destruction of the organic substance, which often leads to cavitations. The treatment for dental caries may often range from very small restorative procedures to very major procedures such as extractions and excisions. The infection spreads to these layers, the complications of the infections rises. Firstly, if the caries is limited to the enamel or the upper part of the dentine, the patient may complain of discomfort, food lodgement or mild sensitivity. So in these cases, we undergo restoration using dental restorative cements such as mainly GIC, composite and dental amalgam. When the infection almost reaches the pulp, we do certain procedures called direct pulp capping or indirect pulp capping technique where we try to regenerate the layer dentine. Next, if the infection spreads to the pulp, the patient mostly complains of pain. We call it pulpitis. It may be acute reversible pulpitis, chronic reversible pulpitis, symptomatic irreversible pulpitis, asymptomatic irreversible pulpitis, chronic hyperplastic pulpitis, or internal resorption. Sometimes the infection may spread to the periapical tissues and may cause apical periodontitis, which is very evident in a dental radiograph. So the treatment option in this case will be root canal treatment, where all the pulp tissue will be extirpated and the space will be obturated by specific obturating materials and the cavity will be sealed, and after some time a crown will be placed. If we ignore these symptoms and leave the teeth untreated, it may further develop into periapical abscess or periapical cyst or periapical granuloma. Spread to the surrounding bone, which we call osteomyelitis, where there is the inflammation of the alveolar bone. After a period of time, the whole tooth structure will be under destruction and there will be no way for saving the tooth by root canal treatment. Therefore, we go for extractions. In some cases, further ignoring the caries and denying the treatment options will lead to severe complications such as cellulitis and space infections such as Ludwig's angina, which often leads to death. Therefore, it is better to treat dental caries in a very early stage by simple restorative procedures instead of very invasive procedures which occur at later on stage. Thank you.